Everything is growing, changing, and evolving, even you, from the student nurse to the baby nurse, the veteran nurse, off the bedside and into entrepreneurship. You have arrived and you have evolved. So, welcome to the Evolve Nurse Podcast. I am your host, Keisha, and we're going to get into this episode today. This episode will end up coming out as soon as I wrap this video because it has some healthcare news splashed in there. And we're going to talk a little bit about the things that happen in healthcare and how to CYA or cover your behind, cover your ass. Okay. How to cover your behind when it comes to being a nurse. All of us know as nurses. And if you don't know, I hope that you have found this episode because this is going to let you know some of the things that we deal with in nursing, especially if you're coming into nursing and you're still a student. One of the things that we learned, especially in bachelor's program, is how to cover your behind, right? CYA, cover your ass. Making sure that you document appropriately, making sure that you're doing things within your state regulations. Those are certain things that you learn. However, in my biology program, I did not learn to go to the state website, see what's legal as far as staffing, see what's legal as far as what type of unit you're on. I didn't know that. I'm just now learning that in my doctoral program. And now what I'm doing is I'm going and I'm pulling the state regulations around certain units and reading through those, especially mine, because of staffing. And so now I'm understanding a little bit more as it pertains to, hey, you're not even supposed to be staffed like this. You're not even supposed to allow for your nurses to have this many patients. And just because your nurse manager says that it's okay, just because your charge nurse says it's okay, it does not mean that it's okay. Because you got to think about it. They're doing the same thing that somebody else did, that somebody else did, that somebody else did. And guess what? I always talk about evidence-based practice. It grows and it changes and it evolves just like this. And when it evolves, you have to move with it. You have to shift with it. And a lot of times, these operating rooms, these ERs, these MED-SURG units, they are operating in the same way that they did in 1930. They're still doing the same practices that they were in 1930. They have the only thing that has upgraded is the facility around them, the new technology around them, and they have kept the same mindset and kept a lot of the same practices. And so let's get into what is going on today. And so I'm going to share my screen with you all, and I'm going to let you see this clip from APRN Beauty. I use a lot of her clips because a lot of the nursing news that I get is from her, because sometimes I don't try to stay in the news cycle as much just because of my mentality, y'all, to keep myself mentally protected. I don't stay in the news cycle a lot, but when I see something and it's coming from her and I've already had, the thought process to make a video based on that, I have to go ahead and do it so that I don't forget. So let me go ahead and share my screen with y'all. Go here. Let's see. We got to turn her up.
Headline reads, Family blames nurse shortage for son's death in Georgia ER. A Georgia hospital is facing a lawsuit after Michael Sheridan died by his own hand in an ER. Trigger warning, this article is going to talk about suicide. Let's take a deeper look into it.
Sheridan.
A Georgia hospital is facing a lawsuit alleging it failed to prevent the suicide of a 35-year-old man who sought emergency psychiatric care and blames lack of staff and oversight for his death. The suit filed by the family of Michael Sheridan claims Memorial Health University Medical Center in Savannah and its staff did not provide the supervision required.
Hold on. Y'all, I did a travel assignment here. I'm just now really looking at this in real time with y'all because I heard a little bit about it, but I didn't hear everything. Let's get into it.
For patients experiencing a mental health crisis. The wrongful death and medical malpractice complaint names several nurses, a physician, a psychiatric nurse practitioner, and the hospital's parent companies as defendants. Sheridan, who had been diagnosed with bipolar disorder, called 911 from a Savannah hotel on January 12, 2024, saying he was having a nervous breakdown and needed help. EMS transported him to Memorial Health's emergency department where he was placed on an involuntary psychiatric hold, also known as a 1013. According to the lawsuit and police body cam footage, the hospital
And I also want y'all to know that that this has nothing to do with nothing, but it's not called the 1013 in every state. So figure out what it's called in your state because I moved to Florida from Georgia and I was continuously calling it the 1013 and nobody knew what I was talking about. Here it's called the Baker Act. There it's called the 1013. Very similar across the board and what terms and conditions would apply to whatever patient you have when applying that involuntary hold, but they are called different things. So know what they're called whenever you're moving from state to state, especially if you're a travel nurse and you're compacted, know what it's called whenever you get there.
psychiatric unit, known as DPOD, was closed that day due to staffing shortages. Instead, Sheridan was placed in a general ER room and designated for line of sight observation, a level of monitoring that plaintiffs argue was never properly implemented. A short time later, Sheridan was found hanging from a bathroom handicap rail using a hospital gown. According to the police report, staff seen him enter the bathroom with multiple gowns, but allowed him in there unsupervised. It took nearly 30 minutes before security was called to break down the locked door, according to a security guard who was interviewed by the police that day. Let's take a look at the video.
Investigative reporter Andy Parati explains how the problem could impact your local ER. And a warning here, this story discusses suicide.
Savannah police respond to a call inside an emergency room in 2024.
So he was like hanging, like his body was like this.
Do you know who initially made that call to security?
Inside this bathroom, a man found hanging from his hospital gown. His name, Michael Sheridan.
I was with him. I was holding him. I had said to the doctor,
Carol is Michael's mom.
I said, "Doctor, how could this happen?" And he said to me, "I don't know." He says, "I don't know."
Before he arrived at Memorial Health University Medical Center, he called 911 from this hotel, begging for help.
Channel 911, where's your emergency?
Hi, hey, I'm having a nervous breakdown.
It happened when the 35-year-old New Yorker stopped in Savannah on his way to visit family in Florida. Diagnosed with bipolar disorder in his 20s, he recognized he was having a mental health crisis.
I'm having suicidal thoughts. I don't know what I'm doing. Please help me, please.
According to a pending lawsuit, when he arrived at the hospital, staff did not help Michael when he needed it the most, claiming they left him unsupervised when psychiatric patients are supposed to be monitored at all times. According to a police report, Michael was seen carrying multiple gowns into the ER bathroom, locking it from the inside. Security forced the breakdown to get inside.
I got there and I'm like, "How long's it been in there?" They said, "Like about 30 minutes. I'm like, "What?" I said, "Why are they just not calling us?"
Natalie Woodward is the family's attorney.
Did everything right. He did everything right. His mom did everything right. I mean, I think that's the tragedy.
With him, Natalie.
What up, nurse gang? What up, TikTok? So, every nurse's worst fear. Today on Nurses in the News, headline.
All right. I hope that Natalie mopped the floor with him, honestly. But yes, let me take a deep breath after listening to that and listening to his call. And honestly, it is I get on here all the time and I say I hope that the family finds peace. But when you go through certain things like this, it's very hard to even grasp the concept of your loved one no longer being there and that they did everything that they could because understanding what a person who has mental illness goes through, a lot of people lack the empathy and they don't take it as serious, which is why they went through what they went through. Because of course, like they said, the DPOD, which is the psychiatric hold unit, closed down for the day. So we're going to put you in general population with everybody else. and they said line of sight, but they were like, okay, maybe I'm gonna just peek over there and make sure he okay. Who was his nurse, honestly? How many patients did his nurse have? And they were saying that it was due to staffing shortages is the reason why he ended up having the freedom to go into the bathroom with all of these items of clothing, because if somebody is 1013, they can't have certain things. They can't have shoestrings, they can't have pencils. I don't even think they have on regular gowns, if I'm not mistaken. But yeah, it it becomes one of those things where it was negligence. And I do hope that their attorney mops the floor with them. However, let's be 100% honest. They listed a lot of people in that lawsuit, right? They listed a lot of people in that lawsuit. And APR and Beauty did do another segment where she said they listed everybody, but they didn't list administration. They listed the doctor, they listed the NP, they listed the nurses. I didn't hear them list that they listed the CNAs, because you can have your CNAs sit. They can be sitters. In certain hospitals, they have designated job sitters. So they have, where I am, they have like a team that just sits. Like they hire people to just sit, or they do a robot. I forgot what it's called. I'm not gonna call it a telemedic, but where basically the robot watches the person, and it's a person on the other side. And so they say, hey, they're getting up, they're doing this, they're doing that. And they watch them. It's like a video watching system. And it's like, did you have the resources to provide that, to make sure that this patient was taken care of? Or you just did not do your due diligence. And that's kind of what it's looking like, that they didn't take all the steps to do their due diligence. Sometimes you can float from other units. If you need somebody, you need to call somebody else and be like, hey, we are overwhelmed down here. Do y'all have an extra set of hands? But let's get into some ways that you can protect your license. We're gonna edit it out. Honestly, let's get into admin, right? Because I was gonna get into some ways that you can protect your license, but let's get into admin, then we'll follow up with the ways that you can protect your license. And so let's talk about how administration, they don't have hands on a patient. So they're not in the documentation, they're not making the orders, they're not doing all of these things that tie them to the patient's record. And so that's why a lot of times they get off on doing certain things. Like they get off on short staffing, they get off on advising you to do things that are not within legal ramifications. They get off on a lot of these things because they are not in the patient's chart. They're not named in the patient's chart. They are scot free when it comes to things like that, because if it wasn't documented, it wasn't done. So say for instance, and I've had this happen. I had this happen to me recently. But one thing about it, two things for sure, safety is my priority. Safety will always be my priority across my practice. Safety will be my priority when it comes to my staff. And I do not want to put them in uncomfortable positions. I don't want to put myself in uncomfortable positions or positions that will challenge our licenses. It would have fallen on me. I'm the charge nurse. That means that I'm the manager overnight. That means that everything is falling on my back, right? And guess who is not in the charts? Guess who is not being mentioned anywhere in patient care? Your administrators. Your administrators, they're not. If it wasn't documented, it wasn't done, which means that at some point we're going to have to start documenting these short staffings. And it's sad that we have to do. And is it lawful? I don't know. I need to talk to somebody in nursing law. Is it okay for us to reached out to nursing administration, listed concerns about short staffing? We'll continue to monitor. And I did see one of those on our documentation list of things that we can do and place in our documentation. But at the same time, it is like one of those things where they are not held accountable for their mistreatment of people. And so because they're not the ones that are being held accountable, they continue to do the same things that they've been done because they feel like it's okay. They feel like it didn't touch them. They weren't impacted by it. They didn't lose their job. They didn't lose their license. So they continue doing the same thing because they're never held accountable. And that's where we need to start. We need to start with the accountability of the administrators who are not hiring properly, who they're trying to cut corners because they're trying to stay within budget. They aren't paying their staff appropriately. They are burning their staff out. Let's talk about burnout and how it relates to nurses. When I tell you I am so burnt, it does something to your body. So when you work nights and you're burnt out, it does this thing to your body. As y'all see, I'm not uploading episodes as like I normally used to. The first year that I did this, I was uploading every week. I have become so burnt out, and I would like to say that it has to do with me being in school, being a new mom, working at night. But the ultimate factor in my burnout is the fact that I'm not only doing my job, I'm doing the job of another department. And then they want to put on everybody else's job as well. And so I'll even get to work and they'll leave me a note to do something that they were supposed to do on day shift. And then I hear that the person that listed the stuff for me to do has been sitting down all day and that they don't help out. And then they come, like, if I'm calling somebody in, they're like, oh my goodness, thank you for all your help because we don't get this on days. Like, you really, really do care about us. And I'm like, yes, I really do care about my staff. Like, I don't want y'all to be fighting for your license. I don't want you to go home and have to carry all this stuff with you. I don't want that because, y'all, in pediatrics, we go through a lot of things. Like, I've been in adults, I've been in pediatrics, I've been in trauma. And I can say that pediatrics is the hardest to be in, especially if you're trauma peds, because you see so many different things, you're going through so many emotions, and if you don't have proper management, your mental state is going to be off. Because when I first did my interview, the first thing that my boss said to me is, we go through a lot of things here. How will you take care of yourself mentally? I was like, oh, I got a therapist, blah, blah, blah. Let's talk about how they don't care about your mental state. They don't care about your mental state. Because once you do something like an organ procurement where you have a kid and it was a traumatic passing, and your A&M, your manager, your director don't even come in and check in on you, how does that make you feel? Then you got to turn around and you got to start another case. No time to debrief. When you have a A&M that could say, all right, y'all, I'm going to give y'all some minutes to, process, debrief. I'll start opening up the room for y'all. I'll grab somebody else and we'll start opening up the room for y'all. It's that simple. It is that simple. Keep your phone on you, forward the phone calls to your phone. Let them know, hey, if it's anybody at the door, y'all can call this number. It is that simple to help your staff. But instead, they will burn you out from both ends and they won't have a care about it. And so since I have started my DNP program after, like I said earlier, I have gone into seeing what's legal, what's not legal, seeing what we're supposed to be doing, what we're not supposed to be doing, how many people are we supposed to have in-house. And I can say this to you now. Where I work now, they are not staffed appropriately per the state regulations, the state laws, not staffed appropriately, which is why I now see why I'm so burnt out. Because I'm doing multiple people's jobs and I'm continuously reaching out like, hey, they don't want to come in. They're arguing with me. And I'm being as nice and kind as possible when I'm calling people in. I'm like, hey, how are you? This is what we have, and I'm calling you in. And as soon as I say that, they're like, whoa, don't you think you should do this? Don't you think you should do that? Don't you think you should do this? And I'm like, okay, I'm just letting you know that the surgeon or the anesthesiologist said that they would need you in-house. Well, like they're going on and on and on. Now I'm 2-3 minutes into this conversation. I'm just sitting there like, okay, so are you going to come in? If you're not going to come in, it's okay. I'll just go ahead and escalate it. we'll make it work. But if you are not going to come in, I am going to, as soon as you say escalate, then everybody's up in arms. Nobody wants to get told on. Nobody wants to accept accountability for their actions. And then they go and tell their managers, oh, well, all I was doing was asking questions. And their manager's like, well, it's okay to ask questions. No, it is not okay for you to try to lead me into unsafe practices because you don't want to come in. One thing about the OR, and I have to say this to you, if you don't want to be on call and you want a certain family life balance, it's not a place for you to go because it's going to be times where you're going to get called in the middle of the night. It's certain times where you're going to be there almost all day long. And if you don't have a good management team, they will leave you in those rooms all day long. They won't give you a break. They won't do this, which are things that are not okay. They're unsafe practices, which is why, y'all, one of my jobs, I had to go on and, leave because I ended up asking my my director. I was like, hey, my scrub techs aren't getting lunches. How can we get them lunches? And she was like, does this have anything to do with you? She told me I needed to stay in my own lane if I wanted to be successful in the profession. And I'm not going to lie, what she said was not far-fetched. As a Black woman in healthcare, the way that you make it to the top is staying in line. Sometimes it's staying in your place. But I cannot look at my team, see them struggling, need to go to the bathroom, can't get out, see that they're going through certain things and they can't go eat. Or if they're pregnant, they can't go to the bathroom, or they're taking on cases that they're not supposed to even be in. For me, as an advocate, not only of my patients, but also of my staff, I cannot simply sit by and watch that happen. I can't do that. Now, that's not me. Now, somebody else can do it. When I first started in nursing, my nurse manager, she was a Black woman, and she said that, we have to work 10 times as hard as them, which meant that she was going to be watching me a little bit closer than she was everybody else. That, to me, it was not okay, because why are you holding me to a higher standard than everybody else? Because you should want everybody to be on the same level. You should want all of your staff to work effectively. You should want all of your staff to treat their patients effectively, not just me. And so I remember going to her and talking to her about CNAs and how we could revamp the orientation process so that they could understand what we do and we understand what they do, so that we can have a little bit more empathy when it comes to understanding each other's job roles. I think for orientation, that's very important, because a lot of times we will judge each other based on what our job is. You'll see somebody sitting down whole time, they backlogged on charting and they fighting for their life to chart all night long in that one sitting period. And their CNAs will think that, all she do is sit down all night long. That's all she doing. And the whole time, like, they've been up on their feet all this time. And by the time you round, they're sitting down and they're charting. And now you feel like they're not doing anything because they're sitting down. And so I wanted to help revamp the orientation program so that we can understand our roles. And I think that with my externship, I was able to understand a little bit more about each individual department's roles, because I went from department to department, that it allowed me to have empathy for other departments that normally people don't have. And I talk about that all the time. And so with that, it's like, okay, understanding and moving forward and trying to understand those things. Well, her mindset was, I'm not leaving this job. She told another nurse that I'm never gonna leave this job. Like, I'm gonna keep my job. And with that being said, that means that you're not gonna rock the boat. You're not gonna be the liaison. You're not gonna stand up for, hold on, y'all. You're not gonna stand up for your staff. And that's just kind of how some people are. They're not going to stand up for their staff because it's about self-preservation. It's about keeping your money, keeping your money, keeping your cash flow, keeping your Skrilla, keeping your dollars in your pocket and not rocking the boat, because if you rock the boat, then people might look at you a certain way. But at the same time, if you're not operating within your state laws and your nursing standards, then it's something to be talked about, right? it is something to be talked about. So now we're going to get into protecting your nurse's license. For me, the way that I protect my nursing license is I see why I cover my behind on all fronts. I put in STARS reports. So STARS reports, that's in my hospital facility and other hospital facilities, where basically that's where you submit issues to quality and improvement. So things like near misses. Oh shoot, I was pulling something out the Omnicell. I thought it was something else and I got the wrong med, but I caught it. That's a near miss. That shows them that they need to revamp something in the system to be able to prevent the patient getting hurt or harmed. Or say, for instance, I've been in several ORs, they might have certain issues in them and you want to make sure that your quality control, hey, this is what's wrong. We need to rectify this. We need somebody to come in. They're supposed to chain of command it and they're supposed to send people in to get it rectified. Okay. Say, for instance, you did wound care and then you didn't do it properly, or your wound care led to something else. You need to, hey, I didn't have the appropriate supplies when I needed it. This is what happened. Or transport. Say, for instance, your wheel locked up. It ended up making the patient fall on the floor, or not fall on the floor, but the bed fell. Something like that. It's real, like you feel like it's kind of small, but STARS report. Yeah, the patient made it safely. They made it safely. But those are certain things that quality is supposed to revise. Maybe we need new beds. Maybe we need new wheelchairs. Maybe we need a new system put in place. Maybe we need these things. And that's why you submit these STARS reports after you've gone through certain things, so that quality understands and knows they have a case in hand and they're supposed to go through and make the changes. Do they always? I don't know, because excuse me, y'all. I don't know, because I don't know what it looks like on the quality side of things. I would love to understand what they do. So I might end up seeing if I can do like a rotation with them for my DNP program. But I know that when they close the case, they send me an email. They're like, hey, we appreciate you for your case. The case has been closed. And then they tell you that you can reach out and ask them any questions. So I think from now on, I'll probably reach out and ask questions like, hey, what do we do to rectify this situation? Just to see if things go further. Because there are certain things that in nursing you're going to encounter that you need to report. And even though you feel like you can't report it, you feel like you're going to get in trouble, it's unsafe, or you don't feel like your management will hear you, you have to report it. You have to, because that's a form of covering your behind, is reporting what needs to be reported, stating what has been done, and also accepting accountability. Sometimes you don't do all the right things, and you have to be able to accept accountability so that you can make the change. Because if you don't accept accountability on that first time that you do something wrong or it's a near miss, you'll continue doing it until it harms the patient. Swiss cheese method, baby. That's what happened in DNP school, y'all. Swiss cheese method. It's basically when all the lines of defenses are up. So you got a piece of cheese and then something happens and it creates a hole. And then it creates another hole. You keep doing it, it creates another hole. And all of these defenses are in place to protect the patient, right? But guess what? You keep creating all these little pockets of holes. And then on the other side is the patient. So one day, when creating all these holes and all the levels of defenses, whether it's systemic or whether it's personally, once all of these holes are created, it has the ability to penetrate and affect the patient. So let's get into how you'll protect your nurse's license, right? So there are several things that you can do to protect your nurse's license. And I'm going to give you a list. So first of all, you want to follow your scope of practice, right? Always work within your state's nursing practice and facility policies. So I know that sometimes y'all don't feel like y'all can go and look at these policies and procedures. You don't have the time to. You better sit down and look at them. You best to sit down and look at them. Even in my facility, it's like, people are so relaxed. It's been this way all the time. And then I'm coming and I'm like, hey, can I get a count? Oh, we don't do the counts at the blah, blah, blah. I'm like, can I get a count? Can I get a count? This is what policy says. So we go ahead and we do it. We're changing our teams. If somebody new is coming in at any given time, according to AORN standards, you can ask for a count. For my OR nurses, I know that sometimes it feels like you can't. I know that sometimes it feels like The scrub tech might not want to give you account. If you got a good scrub tech on your hands, they not gonna mind. I'm telling you, you ask them for account, they be like, hold on 1 second, let me get you account, and then if the surgeon needs something, here you go. Then they'll start their count again. Nobody should make you feel uncomfortable. Everybody should be able to work as a team so that you can get things done. So let's get into the next one. Maintaining accurate documentation. Document care thoroughly, promptly, and honestly. Incomplete or false charting is a common cause of disciplinary action. Incomplete, you make sure that you check it off on everything. I know a lot of people, they only chart what they feel needs to be charted. I was taught by my mentor, my preceptor. She was in, I think I want to say like episode 2 or 3. Let me see which episode she was in for y'all, so y'all will know and y'all can go listen to her. Nurse SWAT. Let me see. Y'all, I got a lot of episodes. Episode 3, What Motivates You, with Ashley, Nurse SWAT. She was my preceptor and she taught me how to chart. And when I tell you she taught me how to chart thoroughly. She taught me how to chart appropriately, and I will forever be grateful for that, because there are so many times where I'm looking through charts and I'm like, they didn't chart that, they didn't chart that, they didn't chart that. And also, my A&M used to write us love notes. So she would go in, she would take a little sticky note. She would go through our charting at the end of the shift, and she'll be like, okay, you didn't do this. And then she'll put a little heart, and she'll be like, okay, so you didn't do X, Y, and Z. And I used to love those little sticky notes, because you don't always know what you forgot. But there were certain people who didn't. They was like, why would she give me this? Especially our travelers that would come through. They were like, why would she give me this? I know what I'm doing, blah, blah, blah. But you don't. And our unit used to get awards for our charting. I remember getting awards for our charting being 100% complete all the time. And so you need to make sure that you're doing your due diligence and maintaining accurate documentation. Use safe medication practices. Double check, triple check, quadruple check your meds, because we've seen time and time again where people are making these unsafe medication practices. And I think recently we saw the young lady who was on live doing the med pass, and she ended up making a mistake. And so when she made the mistake, her go-to was, well, it wasn't a medication error, it was just the wrong time. That violates the 5 patient rights. So it was indeed a medication error. So you want to double check meds, follow the 5 rights, and clarify unclear orders. Sometimes these orders are not clear. When I was in long-term care, the way they used to word stuff, I always used to have to go back and ask. And then sometimes I would have to collaborate with our NPs to reword certain things for our nursing staff. Because they would come to me and be like, Miss Lakeisha, what they mean by this? I don't know what they mean by this. And sometimes if they would have done what they were reading, they would have overdosed the patient. So that's the collaborating with other teams to make sure that we're doing things effectively, or even with pharmacy, like making sure that you're collaborating so that you can do the best that you can for your patients. Okay, and so you want to continue your education and competencies, keeping up with your CE requirements, and know and follow policies and procedures. Again, that's what we just talked about. And so legal and ethical integrity, we talked about this earlier, right? Following the laws, but you never want to falsify records. Remember, we had this whole episode about how in long-term care in Virginia, they falsified documentation stating that they were giving care to a patient who ended up passing away, and they were not giving care to that patient. So that's why you don't want to falsify documentation. If it didn't happen, it did not happen. Allow that to be just what it was. Include timesheets, charting, and patient documentation. Maintain patient confidentiality. Follow HIPAA rules, HIPAA laws, and do not discuss patient information inappropriately or on social media. Again, I talk about this all the time. Your practices in nursing school will reveal itself in the real world. If you are right now giving all your information out about your simulation dummy, your simulation mannequin, then you will follow those same practices when you get out of school. Y'all, it's somebody I know was close to a distant family member, birthed her baby, ain't never said a word. Don't nobody know that I birthed her baby except for her and her family or the people that she told. Will never say, utter a word about her care, about her child, about herself, none of that. And that was years ago when I was in nursing school. Will never reveal who it was, any of that, any factors that could lead to people knowing who she, no, will never do it, has never done it. Might see her in public, be like, hey, how you doing? I'm not gonna be like, oh my goodness, you don't remember when I blah blah blah. No, inappropriate, violates her HIPAA rights. Professional boundaries, and this is what we see all the time. Avoid the dual relationships. Do not engage in romantic, financial, or inappropriate personal relationships with patients or their families. Y'all, this comes with those pictures that you put up on Facebook with the patient and their families listing what happened. Hey, this patient did X, Y, and Z, and the family was so happy that I was there and I gave them appropriate care. Yes, I'm glad that you gave them appropriate care, but you're still violating HIPAA laws. You're still violating HIPAA unless they sign off on a waiver saying that, hey, it's okay for you to post me on Facebook, on Instagram, on whatever. It's okay. And it's okay for you to disclose X, Y, and Z. But when you just take a picture, even in long-term care, people love to take pictures with they little loves. They love their patients. They want to let everybody know, like, this is my patient and I love her and we love each other and blah, blah, blah. But at the same time, y'all, it's not okay. It's not safe practices, and your license can be on the line. Maintain clear social media boundaries, and I just talked about that. Renew your license on time. Report criminal charges or convictions. Y'all, this is just me going down the line. Or report unsafe or illegal practices. Woo! Y'all, report unsafe or illegal practices. A lot of these places are not operating legally. We just need to talk about it, and we need to be honest about it, okay? Then you got to make sure you're taking care of yourself. Take care of your physical and mental health. Burnout and stress can lead to mistakes, y'all. Burnout and stress can lead to mistakes. You come in, you're upset, you're mad. I see this all the time. People coming in, they upset, they're mad at the world. They don't want to be at work because work is not safe. Work is not, it's not helpful. It's not fulfilling. And they're burnt out like from two sides. Like I said earlier, they burnt out from two sides. And you see it written all over their face. And when you have people that are like that, they're not gonna do their due diligence. They're not gonna do the things that they need to do. I see it across the board in certain units. Like if you have a unit that has multiple units under it, you'll see that one unit may not be working effectively. Then you have another unit that's overcompensating for that. Then you have another unit that's not working effectively. And so the unit that is overcompensating for everybody not doing their appropriate jobs, they end up being the most burned out, and they are probably the ones that have to give the most care. So that's just for my managers. Please make sure that you're giving your staff adequate breaks, time off, no questions when it's PTO, no questions when they calling out because that's illegal. Okay, making sure that you're helping them mentally, like what are you doing to provide them with mental stimulation or mental stability? These are things that you need to do. Are you checking in on them? It was one day where I saw that one of my scrub techs was not feeling her best, and I said, hey, can I speak to you? And she was like, yeah, okay. I think she thought she was in trouble. I was like, I just want to check on you, make sure you're okay. Because I saw you on Friday and I saw that you weren't okay on Friday, but I haven't seen you in about a week. So I wanted to check in and make sure that you were all right because I saw what happened. And she was like, oh, I'm okay. I'm okay. And thank you so much. Thank you very, very much for coming in and having this conversation with me because it shows that you care. So you want to make sure that you're providing safe spaces for your nurses. I want people to be able to come to me and tell me how they feel about certain things, especially when it's related to work, because I want to be able to be like, okay, okay, what can we do to rectify this? What resources can I give you to help you out? These are things that you should be able to do as a manager. I'm not a manager, I'm just a charge nurse. But because these are things that we should be able to do as managers, I think that it's important that we do these so that we can retain our staff, y'all. Nursing and healthcare is a revolving door. As soon as we feel burnt out, we are running for the hills. We will find a specialty that we don't have to be around people. We don't have to endure certain things. We might start our own spa. We might start our own clinic. We might start something like that. And honestly, do you. Do you. As I said, we evolve, we change, we get off the bedside, we go into entrepreneurship, we do whatever we need to do for our mental health. But if you are a system, a hospital, a long-term care facility, and you're having issues with retaining your staff, reach out to me. You can reach out to me. I do consultations, and I will help you revise some of your systems so that you can make it easier for your employees. However, those are things that you need to do. But let's keep moving and know when to say no. Do not take on unsafe assignments. Advocate for yourself and your patients when needed. You got to know when to say no. And you got to know when to say no appropriately. Like, if it's something that you can do and you just don't want to do it because you don't want to do it, then that's one thing. But knowing that it's unsafe is a whole nother ball game. Alrighty. So I'm going to give you some documentation that can be legally and professionally curated to protect yourself. So because our documentation and accurate documentation serves as a legal record, a community communication tool, not community, a clinical communication tool in defense in the event of a lawsuit, complaint, or investigation. And so here are some examples of how to cover your behind. Refusing an unsafe assignment. So here's your example. Notify charge nurse at 7:05 of assignment concern due to lack of orientation to unit. Explain patient acuity, unfamiliarity. Charge nurse advised to continue. Documentation made for record. No incident at end of shift. And this shows that you advocated for safe practice and followed the chain of command. However, they still wanted you to do it, but you let them know. You let them know. And luckily, nothing happened, right? But sometimes things happen, as we saw with the case earlier. Patient refusing care. Patient refused dressing change at 1400. Risk explained, including potential for delayed healing/infection. Patient verbalized understanding, provider notified, will continue to offer care per protocol. It shows informed refusal, communication, and a plan. A medication error. Administered 25 milligrams metoprolol at 9 o'clock. Realized dose should have been held for systolic blood pressure less than 90, current blood pressure 86/52. Charge nurse and provider notified immediately. Patient monitored closely. No adverse effects observed during shift. On the error, show action taken and document the follow-up. And then you want to make sure that you talk to your nurse supervisor and everything about this one. I can say that we did see in the Redonda Vault situation where her charge nurse knew about the issue, but because it was not documented, that they weren't held accountable because she wanted to reveal what had happened. However, they were like, no, don't worry about it. Just put in, like, I guess you put in like the equivalent to a STARS report. And everybody acted like they didn't know what happened. So you want to make sure that you include them on your documentation, baby. They knew. Okay. A patient fall. Heard patient calling out at 3:10. Found patient on floor near bedside. Side rose up, bed in lowest position. Called bell within reach. Patient alert, no visible injuries, vital signs stable. MD and family notified. Fall protocol initiated. It shows proactive safety measures, quick responses, and communication. All right, so we're going to get into these concerns. Concern for provider orders. Received an order for 10 milliequivalents IV potassium over 15 minutes. Clarified with provider that order exceeds the standard rates. Order adjusted to 10 milliequivalents over 1 hour after discussion, administered per updated order. I love that because it demonstrates advocacy, critical thinking, and collaboration. Because once you see that and you see that it's not within standards, you're like, hold on now. And then you got to reach out to the provider. So you cannot feel like you have unsafe, like you can't feel unsafe in those relationships with your providers. You have to say it. You have to communicate, because if you don't communicate, it could lead to sometimes potentially a death. Behavioral issues or safety concerns. Patient agitated, pacing the hall, threatening staff, redirected with calm tone. Security and provider notified. PRN lorazepam 1 milligram administered at 1500 per order. Patient calmed within 20 minutes. Safety maintained. It's a clear timeline of behavior, actions, med, and results. So with that being said, it just shows that you're listing the actions that are happening in real time. Do not put your opinions in your charting, okay? I know it's easy to be like, saying certain things. Like I've seen some charting from certain individuals or examples, and I'm like, it's not good to assume. It's not good to assume. So make sure you're charting what you see and not what you feel, okay? Alrighty, communication with providers. Here's a biggie, right? It spoke with Dr. Lee at 1100 regarding patient's increase of shortness of breath and O2 sat dropping to 88% on a 2-liter nasal cannula. New order for 3-liter nasal cannula and chest x-ray obtained. Orders implemented. Provides timely communication and clinical response. And for my long-term care nurses, you can do this as well. Don't feel like you can't. Whenever you reach out to a provider, make sure that you write that note. I used to help my nurses write their notes all the time. Like, hey, this is what you need to do. You need to say you reached out to the provider, especially if you didn't have meds. You see this all the time in long-term care where they may or may not have the meds on hand. So you want to say, hey, medication not given due to medication not being on hand. Reached out to pharmacy to see when it's going to be in. Notify a provider. Will continue to follow up. And then if the provider puts in something extra, if they know that you have something on hand and you can get it out of your Omnicell in the back, then you do that as well, and you still update your charting as you go, okay? Again, bonus tips for providing documentation. Avoid vague terms. Instead of putting patient doing okay, write patient alert oriented ×3 ambulating without assistance. Never document opinions or blame. Like I said, stick to facts. Don't write Dr. Smith made a mistake, because you don't know whether Dr. Smith made a mistake or not, right? You're just assuming that Dr. Smith made a mistake. But do not put that in your charting, y'all. Use quotes when appropriate. Patient stated, I'm not taking that pill. It makes me sick. Document late entries properly. Always date and time the late entry and explain why. But yes, y'all, that is it for today's episode. Again, like I said, make sure that you're covering your behind, doing the things that you're supposed to do. Don't know what's going on with my language today, y'all. Get it together. I hope that you all have a great week. You will have another episode being released by me on Wednesday, but today I just wanted to make sure I came to you all and put out this episode, because y'all, when you burned out from two ends, you got to make sure that you're giving your people what they want. And I have to get y'all episode. You know what I'm saying? I got to give y'all episode. So y'all make sure that you go and follow the Evolved Nurse on Instagram, and also where else? If you have any questions, you can email me at theevolvednurse@gmail.com, as well as TikTok, the Evolved Nurse. Down in the description, we do have Yoni Potion that you can get for, I think, 10% off, and you can grab it down below. Okay, very great product. You should try it for reproductive health. And if you are a man watching this and you want to have it, it's okay. It tastes good. I'm sure it will be great for something in your health ether. And if you have a loved one that you want to gift it to, you can also do that as well. And then we also have down in the description Black Girl Vitamins, as well as Nursify, if I'm not mistaken. Y'all, it's a lot of them. It's a lot of them. But yes, all in all, keep a lookout for the next tea party that will be coming up next February. Keep a lookout. Those early bird tickets will go out very, very soon. So you want to make sure that you are on the lookout for those. The tickets go very, very quick. So you want to make sure that you are staying updated, keep your eyes close. Okay? Keep your eyes close to the social media sites. And yes, y'all have a great day. But that is healthcare news with Keisha as far as this pertains, and giving y'all a little bit of extra to be able to cover your behinds and have safe practices and protect your license. Y'all have a great day. Bye.